Place your infusion materials on a clean, flat surface. Check the expiration date and verify the correct potency to be infused. Allow Adynovate anti-hemophilic factor recombinant pegylated to warm to room temperature before use. Wash your hands thoroughly using soap and warm water. Remove Adynovate anti-hemophilic factor recombinant pegylated with BaxJect3 system from the packaging by peeling away the lid. Visually inspect the contents of the product and diluent vials. Then set it down on the flat surface with the diluent vial on top. You can identify the diluent vial by the blue stripe. With one hand holding the Adynovate housing, press down firmly on the diluent vial with the other hand until the system is fully collapsed and the diluent stops flowing down into the vial containing the Adynovate product. Swirl gently until the Adynovate is completely dissolved. The product dissolves rapidly, usually in less than 1 minute. The solution should be clear and colorless. Remove the blue cap. Take the syringe and push the plunger all the way in. Screw the syringe into the system, but do not over-tighten it. Turn the system over so that the diluent vial with the blue stripe is on the bottom and the vial containing Adynovate solution is on top. Slowly draw the solution into the syringe. Be careful not to inject air into the BaxJect3 system. The contents of more than one vial may be drawn into a single, appropriately sized syringe if more than one vial of Adynovate is being used. It is acceptable for a small amount of liquid to remain in the vial. Once you've collected the reconstituted Adynovate, you are ready to continue with the infusion process. Please see the Adynovate with BaxJect3 system troubleshooting video if you have difficulty with reconstitution. Always read the package insert before using Adynovate, anti-hemophilic factor recombinant pegylated. Important: contact your healthcare provider or local hemophilia treatment center if you experience further problems.
Adynovate, anti-hemophilic factor recombinant pegylated. Important information. What is Adynovate? Adynovate is an injectable medicine that is used to help treat and control bleeding in children and adults with hemophilia A, congenital factor VIII deficiency. Your healthcare provider, HCP, may give you Adynovate when you have surgery. Adynovate can reduce the number of bleeding episodes when used regularly, prophylaxis. Adynovate is not used to treat von Willebrand disease. Detailed important risk information. Who should not use Adynovate? Do not use Adynovate if you are allergic to mice or hamster protein, are allergic to any ingredients in Adynovate or Advate, anti-hemophilic factor recombinant. Tell your HCP if you are pregnant or breastfeeding because Adynovate may not be right for you. What should I tell my HCP before using Adynovate? Tell your HCP if you have or have had any medical problems. Take any medicines, including prescription and non-prescription medicines, such as over-the-counter medicines, supplements, or herbal remedies. Have any allergies, including allergies to mice or hamsters. Are breastfeeding. It is not known if Adynovate passes into your milk and if it can harm your baby. Are or become pregnant. It is not known if Adynovate may harm your unborn baby. Have been told that you have inhibitors to factor VIII because Adynovate may not work for you. What important information do I need to know about Adynovate? You can have an allergic reaction to Adynovate. Call your healthcare provider right away and stop treatment if you get a rash or hives, itching, tightness of the throat, chest pain or tightness, difficulty breathing, lightheadedness, dizziness, nausea, or fainting. Do not attempt to infuse yourself with Adynovate unless you have been taught by your HCP or hemophilia center. What else should I know about Adynovate and hemophilia A? Your body may form inhibitors to factor VIII. An inhibitor is part of the body's normal defense system. If you form inhibitors, it may stop Adynovate from working properly. Talk with your HCP to make sure you are carefully monitored with blood tests for the development of inhibitors to factor VIII. What are possible side effects of Adynovate? The common side effects of Adynovate are headache and nausea. These are not all the possible side effects with Adynovate. Tell your HCP about any side effects that bother you or do not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. For additional safety information, please see accompanying prescribing information and discuss with your HCP.